Hey, it's Dr. Langford. I wanted to talk to you about something that's really difficult and, quite honestly, very sad topic, and that is sexual abuse before the age of 18. And the reason I'm bringing this up is because it happens to 1 in 4 women in the United States and 1 in 20 men in the United States before the age of 18. Think about that. That means that every one of us, if it's not us ourselves, that have experienced or know someone who has experienced this type of abuse. The reason it's important, besides awareness and besides getting the obvious help that everyone needs, is that it can cause some serious pelvic floor dysfunction in people that experience this as children. So sometimes I will see patients in the office and they will tell me that they have difficulty with urinating or pelvic pain or pain with intercourse or other types of voiding symptoms or severe constipation or some kind of pelvic floor dysfunction, chronic prostatitis, interstitial cystitis, different combinations of pelvic floor dysfunction. And when we get back to it and we start talking about their history, many times they'll tell me or confide in me that they've had some sexual trauma in their past. And unfortunately, sometimes this does happen before the age of 18. Not that it is any less tragic after the age of 18, but it's particularly tragic in children. And I think it manifests in them as adults as some physical symptoms. There's a really great book out there called The Body Keeps the Score that explains this in more detail. But I wanted you to know that if you're experiencing urologic symptoms and you're someone who has experienced this, first of all, you're not alone. And second of all, there are really good trained professionals that are willing to help you to overcome these issues and help you to have a more normal pelvic floor so that your process of getting over these traumas can be improved both in your physical health and your mental health. So please reach out to someone if you feel like this may be you. At the very least, speak to your primary physician or your psychiatrist or your counselor or even just a friend so that you can start to get the help you need because you do not have to suffer the physical manifestations of some of these traumatic events for your whole life. So if you have any questions or want to direct message me, please do. I'm happy to answer any questions if you list them below. And I hope at the very core of this, what I'm pointing out to you is that you're not alone and that there are people that are willing to help you to get through this difficult situation.